World Health Organization will hold an emergency meeting to find ways to battle the Zika virus. WHO could classify the outbreak, which is now in 25 countries and territories, as a public health emergency of international concern. So what would this classification mean for you, and what's the next step in fighting this virus? Well, Dr. Christina Leonard from Spectrum Health is an infectious disease specialist, is joining us this morning. First off, thank you for being here today.
Thank you for having me.
Should we've heard so much. You've seen the pictures. Some of them are gruesome when you look at the effects on newborn babies. Is this a disease, a virus we should be worried about?
It's not a virus that the average non-pregnant person has to worry about. It causes really mild disease, if any symptoms at all, in most people.
I know a lot of the talk is this is new to a lot of people. As you see these effects, specifically South America, Brazil, this is not a new disease. Do we know how to battle it?
Well, it's not necessarily the virus itself that we have to battle as much as the spread of the infection that we need to battle, and that involves educating people about bite prevention and controlling mosquitoes. That is the biggest goal, I think, at this point.
So what are some things that we can do to prevent being infected?
If you're going to a place that has active transmission of the virus through mosquito bites, then the best thing you can do is wear bug spray on your skin and then over long sleeves that you wear. And for Michiganders, these bugs, these mosquitoes actually don't bite at dusk. They're day biters, and so they're most active in the morning after sunup and in the evening for the few hours before sundown.
So today, the World Health Organization could classify this as a public health emergency of international concern. That's a pretty big deal because they've only done it 3 other times, with the polio outbreak in Syria in 2014, Ebola in 2014, and a third time, can't think of it off the top of my head.
The H1N1 in 2009.
H1N1 in 2011. Why is this such a big deal? Why is this a public health emergency of international concern if you say that the average person really won't feel the effects of the Zika virus?
Right, because of this strong suspicion of a birth defect and the rapid spread. Normally, if it was just spreading through South America, Central America up here, the symptoms are so mild we wouldn't be too concerned about it. Causes maybe fever, rash, but if it infects a pregnant woman, there appears to be this pretty devastating complication, and that's what's so disconcerting about this virus.
So definitely that's something that we'll keep our eyes on today. The World Health Organization could classify the Zika virus as a public health emergency of international concern. Dr. Christina Leonard from Spectrum Health, an infectious disease specialist, joining us this morning. Thank you so much for your time.
Thank you.